Walters. I'm the Executive Director for HOSA Future Health Professionals. I'd like to introduce our panelists today. I'll state their name and let them tell you a little bit about themselves and their history with the organization. This is Nick Ballard, our International President-elect.
Yeah, this is my 6th year in HOSA Future Health Professionals, first time at the IdeaGen Global Goals Summit, so I'm super excited to be here, and I'm joined by Marcus Henderson.
Hi, good afternoon, everyone. My name is Marcus Henderson, and I have the honor and privilege of serving as chair of the HOSA Inc. Board of Directors, which in effect is the parent organization, if you will, of HOSA Future Health Professionals. And I have been with the organization since 2009, when I was in my high school career and technical education program, and have stayed engaged as an active student, alumnus, and now active global leader in our international organization.
And that's one of the great things that we all share in common, is that at some point we've all been members of the organization and are coming back to serve in various capacities. And I think we really need to dig into what is HOSA Future Health Professionals. And Nick, I'll ask you that question in describing what we do and what our goals are.
Yeah, so HOSA Future Health Professionals is a career and technical student organization. We're fortunate to be recognized by the U.S. Department of Education for our partnership with health science educators. We're also international, so that means that we're in multiple countries, and we really serve as a bridge in that capacity for developing tomorrow's health professionals by empowering them to realize their abilities, their diverse talents and skill sets today. And so we do that through a range of different programs. We have competitive events, conferences, but aside from beyond the classroom, we also have programs within the classroom. We're heavily integrated within health science education, and I think the ability for us to be within the classroom and extend beyond the classroom to provide that excitement about healthcare and the healthcare industry for students all across the world is what serves to our benefit collectively to be the pipeline of future health professionals.
And that's exciting. That's really building off that Sustainable Development Goal 4 of quality education, and particularly bringing equitable access to career and technical education experiences. That's one of the things that I love. We talked about all being members of the organization, but having various backgrounds. I grew up in a very rural community, only having about 1,100 people in the town that I grew up in. And Marcus, you were in inner Philadelphia, very different areas of the world, but yet we had very similar experiences within the organization. So why don't you tell us about what was your experience in HOSA and how that shaped your future professional journey?
Right, and thank you so much, Sarah. And I think one thing that's key for all of us to understand in this room and joining us today online is that HOSA is a student-led organization. So I'm a registered nurse by education and training, specifically psychiatric nursing, child and adolescent psychiatry. But I would not be the person, nurse, or leader I am today hadn't it been for my involvement in HOSA Future Health Professionals. Nick was talking about how HOSA is integrated in the classroom. So we take students who are in health science education programs who have interests in health careers in the United States and globally, and we bring them in to enhance that classroom learning. We rely on teachers, health science educators, to give us that competency-based education and skills-based learning, work-based learning experiences. And for me, that was in a health-related technology program that was producing most of us to go into careers in nursing. We had a particular focus on nurse assisting in the program that I participated in high school. And for me, it was attending our state leadership conferences, our international leadership conferences that boasts over 10,000 young people who are interested in taking care of a global society. So for me to be sitting here public speaking, those soft skills, and I think we talked a lot about that today, it's not just the knowledge you possess and the competencies you hold, but it's also your ability to establish relationships, to connect, to collaborate, work in multidisciplinary or interdisciplinary teams. And that's what HOSA Future Health Professionals is. It's enhancing that classroom learning to put students in opportunities and spaces and places that give them that ability to see diverse people, diverse experiences, diverse thought. And that's really, I think, what you're talking about is what brings us all together, growing up in very different places in the United States, but coming together for a common goal of being global leaders in a global society.
Absolutely. And then touching on that we are a student-led or member-led organization and really elevating our students and our members to the highest level. And that's what you're doing, Nick, and being our international president-elect. What does it mean to be a member-led organization and being a leader in that organization?
It's a great question, and it really means, when it comes down to it, that the student voice is something that has a real stake at the table. So, throughout my entire HOSA journey, whether it was me starting out in high school, having no knowledge of the healthcare industry, upon me entering or serving on North Carolina's Chartered Association Executive Council, up until now, it's always been about the ability to serve my peers. And I think what's so important about peer-to-peer advocacy is that it has a greater influence and really impacts the quality of the education. Because one of the initiatives that the International Executive Council has this year is, instead of being or positioning ourselves necessarily above the membership, we want to make sure that we speak from within the membership. We speak as members to one another, peer to peer, and through that we think that we can inspire and achieve our mission of empowerment for future health professionals, and really touching on that excitement about the healthcare industry that we hope will alleviate the issue of workforce shortages that we're seeing around the world.
And that was a great collaborative effort from your team in brainstorming together and coming up with initiatives and how to roll that out. We've talked about some of those experiences. Can you describe the recent event where your team worked with our membership in terms of training and honing in on those leadership skills where you rolled out your compact?
And that was right at Washington, D.C. for our annual Washington Leadership Academy. It's a great experience for chartered association leaders, chapter officers, and members alike to really hone in and develop their leadership skills. We also get to tour Washington, D.C., which is a great experience all around. And with that, this year, as mentioned, we really focused on putting ourselves within the membership and trying to show that a student-led organization involves all of us in the organization to do our part and to inspire and motivate our peers to be the health professionals that we want to be.
Wonderful. And I think that's a great vision of, we think about healthcare a lot of times as those clinical roles. Marcus and I being registered nurses and Nick majoring in health policy, and we saw policy, advocacy, and those discussions that happened while we were in Washington, D.C., and that is really all-encompassing of what we talk about at HOSA Future Health Professionals are the clinical and non-clinical sectors, those cross-sector conversations of how we add value to the entire healthcare system. And we want to bring that to the health system in total through these pipeline programs or career pathway programs. Marcus, can you talk a little bit about the outline and need for the types of these programs and their impact on the health professions?
Right. And I think it's often said that HOSA Future Health Professionals is the best kept secret in healthcare. And why is that? Well, one thing we didn't talk about yet is the number of members we have globally. And that's over 260,000 people. That's middle school, high school, post-secondary, college, health science educators across the world who are engaged in our organization. And that gives us in the ballpark of somewhere around 3 million alumni that our organization has touched since its existence in 1976. So best kept secret, and why that relates to shortages that we're seeking to address. Those of you who are familiar with the health professions education or health professions sector know that most of the targeted work to fill gaps in certain health professions areas targets collegiate or postgraduate individuals. We're looking to find more nurses, physicians, physical therapists, occupational therapists, what have you. Let's go to them in college. When in fact, most of the evidence and data suggests that young people are making that decision in high school, if not earlier, in middle school. So again, a market that we have access to that most people don't realize, that through partnerships with our organization, we can give you access to the people that are going to be taking care of you. But, and just some other data to throw out, the World Health Organization projects a shortfall of 10 million health workers globally by 2030, most significantly impacting low and middle income countries, exacerbating disparities. Here in the United States, The Health Resources and Services Administration estimates that 100 million people in the United States live in areas without primary care. 166 million people live in mental health profession shortage areas with no access to mental health services. So again, we're an organization of middle school, high schools, post-secondary, collegiate young people who want to fill these gaps. And again, we're beyond the traditional healthcare, the direct care clinical providers. We have students interested in health informatics and IT, public health science, public health practitioners, health policy and law, health innovation and entrepreneurship. So again, thinking differently about how we're producing leaders in health, not just to provide direct care, but also lead with a health-focused, health equity-focused lens in other sectors that impact health. And I think what we've talked about a lot today is how everything here impacts health, not just what we do in our specific sector in health.
Absolutely. In looking across the broad array of careers that are in health, we look not only to those in the post-secondary space, but some of those that are direct entry, graduating from the programs that we have in health science that are in our high schools, and some in the early collegiate programs. And Marcus, we learned recently about your chapter established an amazing program that demonstrated that impact of a youth employment strategy that aligns to the Decent Work and Economic Growth SDG. Can you tell us a little bit more about that program?
Yes, so in brief, the high school I attended, the Career and Technical Education program, now is a medical assisting program. So high school students from this program graduate with an industry-recognized credential as a certified medical assistant. And the Children's Hospital of Philadelphia developed a partnership with my high school and said, any of your students who graduate as a certified medical assistant, if they want to be employed by the Children's Hospital of Philadelphia, we're going to take them. 15 of, I think, roughly 30 students took employment, and they're now in a newly designed medical assistant fellowship program that's not only giving these young people gainful employment, tuition benefits, health benefits, again, most of these students from low-income, disadvantaged communities, so giving them that real opportunity to scale up their own lives, but also providing them with dedicated professional development and mentorship, recognizing that becoming a medical assistant is just the first step in their healthcare journey. So offering them opportunities to go back to school, to obtain a bachelor's degree or postgraduate education in nursing or as a physician or in other health-related areas. And they're the types of partnerships we need. And CHOP, the Children's Hospital of Philadelphia, recognized that we have this cadre of young people who need their support, who might not otherwise have that. And as a first-gen college student from a low-income, single-parent household, I wouldn't be where I am today if it wouldn't be for partnerships like that, and we need to make sure we continue making those connections.
And that's where the data is too, that talks about those low-income individuals when they have access to these relationship-based, work-based types of organizations and experiences, those really lead to increased job satisfaction, measured by wages, measured by happiness in the workplace. So it's great that we're seeing these programs really rise up to not only meet the needs of the industry, but change the lives of those students, individuals, and the communities that they serve. And that really leads us to talking about the state of our mental health in our youth. And that has been something that we have looked at in strategy and offerings, peer support. Can you talk about some of the programs and events that we have?
Yeah, so we offer next to 100 competitive events in all sorts of niche areas of health science and healthcare, and the ability for students to test their interest by trying stuff out and giving it a try, especially in different formats, whether it's testing or on-the-job shadowing, I think is a real benefit to these students, especially early on when they're in middle or high school divisions. And to the point of mental health, we do have competitive events that heavily relate to mental health, and it's something that we have to be conscious of as an organization who represents a student voice and represents the future of healthcare, that mental health is a critical part of healthcare. It was mentioned earlier, why do we separate physical health and well-being from mental health? It should be sort of the same thing and recognized, encapsulated all in one in primary care. And that really resonates with us. It resonates with the healthcare industry, and we hope to continue, pushing and promoting for mental health on the student level.
That's great. And Marcus, as a psychiatric mental health nurse, can you talk about some of the positive protective factors that being a part of HOSA and the greater community has on youth and mental health?
Right. So George said I could give half of my dissertation, right, while we're here. So I'm a PhD candidate at the Johns Hopkins University studying adolescent suicide prevention. So Sarah's question is piques my interest greatly, just not only as a practitioner, but also as a researcher. And when we talk about the protective factors of HOSA, when we talk about the protective factors against mental illness more broadly, it's really social and community connectedness. As someone who studies suicide and suicidal behavior, we know one of the most prominent protective factors to support people experiencing suicidality is a sense of belongingness, a sense of purpose, a sense of not feeling that they're burdening someone else. And that's the type of community we provide at HOSA Future Health Professionals, a place of inclusion, a place of belonging, a place where you get to explore through competitive events, through leadership development, through a variety of program and opportunities. Where do I fit in this world? Where are my talents best used? And how do we help young people to discover and explore those in a safe environment. So I think that's really what's important about HOSA, and we're thinking about ways to study and capture that. We have colleagues in California HOSA who have begun trying to document, how is HOSA actually protecting the mental health of young people in this country. So it's something we're greatly interested in, and we know that this connectedness, this sense of community and cohesion that we are building and have built over our history is definitely a key piece of that.
Great, and thanks for providing that perspective for us. We're going to move in as we're wrapping up the end of our session into the lightning round, but being in healthcare, we're going to call it checking the pulse. In your opinion, what's the best benefit that HOSA provides that contribute to HOSA members being successful in the workforce?
Well, we're talking about the global goals today, and I think it's been mentioned quite a few times that action and learning by doing, that a need to address the global goals and perhaps a lack of action today. When it comes down to it, I think one of the really great benefits of HOSA is that we stress that although we're developing them to be health professionals tomorrow, they certainly have an ability to impact today. And so we really encourage through our core values, learning, leading, service, and innovation, for them to make that real impact today through their chapters. And so we see all the time chapters hosting blood drives and drives for our national service project, Be the Match, and really making tangible impact in the healthcare industry while they're developing their interests for whatever health professional they want to meet they want to be in the future. And for me, that's the greatest good that we could possibly do today, much less for the future when we're developing these future health professionals.
Great, and I think quickly in our last few moments here, I would say teamwork and collaboration. One of our previous speakers today talked about his concerns and worries about young people today and how the lack of face-to-face interaction really is contributing to some of the downfalls we're seeing in the workplace today, and I think that's what HOSA provides. We really instill teamwork, collaboration, and engagement. Our competitive events program certainly does that, where we actually require young people to build teams of 4, 5, 6, 7, 8 people to come together to share, to come up with a shared goal and shared actions, as we heard today, to address key problems. One of our events, Mental Health Promotion, actually requires them to go out into the community and identify a mental health expert to serve as a consultant on their projects that they're doing to advance different issues in their community. So really, and that's what the workforce needs. They need individuals who are used to working in teams, diverse teams, problem solving within teams, and I think that's really what we're providing students. Because I've been working in teams since I was in high school, and that was because of HOSA. And it's made me an effective team player now, being in the workforce.
That's wonderful. And what's your final call to action for our audience today?
I would say industry partnerships with our students are truly incredibly impactful. And when it comes to developing our future, I think we should really invest in our youth. And I think, Hosts of Future Health Professionals is a great way to invest not only in our youth, but in the future health and well-being of us all.
And I think my call to action would be go to www.hosa.org and learn about us if you haven't heard about us. We're in 54 different states and territories across the world. So if we're in where you live, connect with us, join with us, work with us, partner with us. And if we're not, let's make that happen. Let's get Hosts of Future Health Professionals where you are to begin addressing the needs of your local communities, whether that's here in the United States or abroad. So go to HOSA.org and join us, or allow us to join you on this journey to advance the UN Sustainable Development Goals.
Wonderful. Thank you both, and thank you to Adiagen and George Safakis for having us here today. We are excited to be partnering with you and to have this opportunity to share our mission and our goals to change the future of health.